There's been a significant correlation between HHV-6A infection and infertility. Like I said, particularly unexplained infertility.
In pregnancy, if HHV-6 is present, there is much greater likelihood that the pregnancy will fail.
We do know that it can persist in the lining of the uterus.
And it is not a symptomatic virus in this setting. There's no fever, there's no discharge, there's really no way outside of looking for the virus in endometrial tissue to know and understand if HHV-6A is there. If you can get the virus quiet while the embryo's trying to build his original little nest, give him a chance, which comes to about a heartbeat, 6-8 weeks, and it's a stick. I mean, he's like in there. He's got this one.
One of the obstacles or barriers to obtaining a diagnosis is, unfortunately, the invasiveness of the tests, and coVee eliminates that. Obtaining endometrial cells, which is the lining of the inside of the uterus, requires an invasive test like an endometrial biopsy. It's not a very pleasant test.
Snippets of tissue are pulled from the endometrial lining and basically vacuum back down that little tube and into a collection dish. We've tried to make it easier for women to be tested, and that's with the collection of menstrual fluid instead of a biopsy process. And actually, we get more cells to analyze from the menstrual fluid than we get from the tissue samples. It's just a better sample.
The benefit and the great thing about this test is it completely eliminates the need for an invasive intervention. The woman can collect menstrual blood at home in the kit that's provided to her, send it to the lab that can be tested.
We're just trying to make things more accessible, less invasive, and hopefully more cost-effective. The good news, and specifically with HHV-6A, it is sensitive to acyclovir, valacyclovir, which is a drug with an excellent safety profile. There's over 50,000 data points in pregnancies that showed no adverse outcome over people not taking the drug. It's an antiviral that is usually taken twice a day, and there's no deleterious effect on the fetus. We've had patients come through here, and I see, honestly, 4, 6, 10 failed embryo transfers. They're HHV-6 positive, they get treatment. Sometimes they may have another miss, but within a cycle or two, more than half of them become pregnant. And if you can get to the heartbeat, it is largely smooth sailing. It's a good bet, and it's something we can do not invasively. Even the treatment is kind of a nothing muffin. It makes so much more sense to intervene earlier in the course of a patient's workup. You know, those basics. Is there good semen? Is the uterus looking healthy? Are the tubes open? If all of those things come back and they look good, you would also, as part of that initial workup, check for HHV-6. At least get this so that it is not an impact factor.
For a significant portion of the infertility population who don't have answers, it has the capability of provide those answers for you. Give you some closure and provide treatment that where you may potentially avoid expensive, invasive, and unnecessary treatment. So for couples who are facing unexplained infertility, recurrent implantation failure, based on the HHV-6 Foundation and obviously recommendations from Fertility Phoenix, testing is recommended. It's non-invasive, it's fairly inexpensive, it's fairly accurate, and the treatment may improve the outcomes.
If testing is positive and treatment is successful for HHV-6 in endometrial tissue, we would save many individuals a lot of pain, a lot of expense, and help people create the family that they're so desperate to have. The concept of HHV-6 being a spoiler in conception and in pregnancy has not trickled down to the more entry-level healthcare provider. We were set to do a presentation at the American College for Obstetrics and Gynecology. That is their huge national meeting that was supposed to take place in April of 2020. We were trying to move into the frontline guys, right? And another darn virus, SARS-CoV-2, the rascal, he just threw us a body block. I am absolutely convinced and committed to make this concept better known amongst clinicians, nurse practitioners, the general public, because it'll save a lot of pain. It would save a lot of pain for a lot of people. I just want people to have the hope, the option of maybe checking off another thing that may or may not be involved in them not being able to conceive.